Welcome everyone. Today's presentation is on the respiratory system and acid-base disorders. Today I will walk us through how the respiratory system regulates acid-base balance, what happens when disturbances occur, and the clinical consequences. So let's begin. We will follow this outline as we move from physiology to clinical relevance. So today we will discuss respiratory system and acid-base regulation, mechanisms of basic acid disorders, clinical examples and consequences, and summary and conclusions. And that will be the outline for today's presentation. So by regulating blood carbon dioxide levels, the respiratory system is essential to preserving acid-base balance when carbon dioxide dissolves in plasma. It reacts with water to create kind of like a carbonic acid. This weak acid splits into a bicarbonate and hydrogen and ions very fast. Because of this connection, carbon dioxide is a very important blood pH regulator. A decrease in ventilation and causes carbon dioxide to build up, which raises hydrogen ions, and then begins to lower pH. So on the other hand, carbon dioxide is expelled, then hydrogen ions fall, and pH increases as ventilation increases. The lung serves as the body's main mechanism for short-term acid-base regulation, which is due to their quick ability to alter hydrogen ion concentration. The lungs respond in a matter of minutes, while the kidneys offer longer-term compensation. So the carbon dioxide biocarbonate buffering system is depicted in a simplified diagram on the slide. You can see right here that the buffering reaction causes changes in ventilation to directly affect blood pH. This demonstrates how closely breathing and acid-base regulation are related. These are the link between both ventilation and blood gas changes. When ventilation is insufficient, carbon dioxide retention results in respiratory acidosis. This is the equilibrium between carbonic acid and bicarbonate is upset by this retention. This lowers blood pH and produces too many hydrogen ions. The most frequent cause is hypoventilation, brought on by illnesses such as severe airway obstruction, neuromuscular disorders that affect breathing, or even chronic obstructive pulmonary disease. It can also be brought on by acute respiratory depression, such as which results from an overdose of sedative drugs. An increase in arterial carbon dioxide and corresponding decrease in pH are the immediate results. The kidney gradually starts to make up by this by secreting hydrogen ions and reabsorbing more bicarbonate over the course of several hours to days at times. So excessive ventilation causes excessive carbon dioxide loss. which results in respiratory alkalosis. What this does, it begins to raise blood pH, then also lowers hydrogen ion concentration. The condition can be frequently occur in response to hypoxemia, such as high altitude, anxiety-induced hyperventilation, or acute pain. People that breathe deeply and quickly in this situation, it lowers their carbon dioxide levels below normal. A decrease in carbon dioxide and an increase in pH are the immediate disruptions. The pH gradually returns to normal as the result of kidneys compensation by lowering bicarbonate reabsorption. Since acid-base disturbance impact most every organ system, it is clinically important to comprehend them. For instance, alkalosis can result in arrhythmias and neuromuscular irritability, when acidosis can depress the central nervous system and induce confusion and coma. The primary diagnostic method for assessing these conditions is arterial blood gas analysis. So what they do is they can either identify whether a disturbance is respiratory, metabolic, or mixed by analyzing the pH, carbon dioxide, and bicarbonate levels collectively. So to sum up the discussion that was had today, we did go over by controlling carbon dioxide, the respiratory system preserves pH equilibrium. Also, hyperventilation causes respiratory acidosis, which lowers pH and causes carbon dioxide to be retained. Hyperventilation leads to respiratory alkalosis, which raises pH and causes carbon dioxide to be lost. So the key point was that the kidneys gradually modify their handling of bicarbonate. This is a result that comes of compensatory mechanisms that are triggered by both disorders. So clinically, the foundation for identifying and treating these disruptions is blood gas interpretation. These specific fundamental ideas clarify why doctors closely monitor ventilation in critically ill patients. They also will be emphasizing on the respiratory system's critical role in maintaining acid-base homeostasis within the body. So thank you for joining me today on my discussion. These are my references that were used for this presentation. Thank you.